Okay, welcome everyone. Thank you. DeBorah Boneta is joining us as an Oklahoma Leadership in Education and Neurodevelopmental Disabilities and Related Disorders resident. She is a family member and is going to be sharing about her experiences with us as mental health professionals. So why don't you give us a little bit of background on your role and your experience?
So thank you for having me today. I am the mother of 4. And so I have a child that is 33. Well, I guess he's not a child, but he's my baby. 33 who is developmentally delayed. I have a 27-year-old with cardiomyopathy, LV non-compaction that needs a new heart. I have a 12-year-old that has cerebral palsy. He's a quadriplegic. And has lots and lots of little health things we need to kind of get over. And I am also one of those sandwich generations that I have my mother who is 80 and has dementia. So yeah, I may need some mental health, but so my role has been family caregiver from the top to the bottom. I have kind of taken on the role of the matriarch for our family. And I also advocate for other families that have children with severe to profound disabilities.
Yeah, it sounds like you have a lot of experience with caregiving across the lifespan with your family and in a variety of contexts. What do you think would be most helpful for mental health professionals at different levels who are working with families who are experiencing some of these challenges?
So I think, first of all, it would be to consider all of the circumstances. You know, a lot of times we compartmentalize and we have this little compartment that we believe is our profession. You know, whether it's a caregiver, whether it's a professional, whether it's medical, mental health, whatever. And in that, we are so focused that we only think of this. And so from my point of view, and even with the families that I have dealt with, understanding that mental health help is very difficult for us. First of all, it feels like I am not enough for the situation, you know, and so I already have that burden of, man, am I going to fail at this? I'm going to let somebody down. Am I going to make the wrong decision? And then someone suggests that maybe you need some mental health person. And so when I come and sit in your office, I'm going to have a chip on my shoulder. And so understand that that chip comes with a lot of things. A lot of my own personal feelings in the beginning of my journey as a caregiver were that I would be judged. That if I went to go get mental health assistance, someone was going to judge me as not being able to take care of my children, not being able to take care of my mother, or weak. And if you think of the not only the psychological issues, but the cultural issues. So not only am I African American and a woman that is thrust into this caregiver position, but I'm also Muslim. And what does that look like from all of those different perspectives? What is the cultural component that falls into those things? Black women are typically seen as strong. You know, I was in a situation and at work, and I asked them, you know, why did you put me in that position? And my supervisor told me, well, you're a Black woman, you guys can handle anything. Wrong answer, very wrong answer. And so this fight or flight, and when you are constantly in this fight, you know, it wears you down. And it does create other health problems that a lot of times caregivers of any color don't look at and see. So when we come to someone for help, that is a huge thing. That's a really big thing. And I want maybe the people in the mental health arena to know just how big of a deal that is for some of us to reach out for help.
It sounds like even getting through the door or getting into somebody's office is one level, one challenge, or is something to be met with understanding from the professional side.
Absolutely. You have to, so for me, I would have to, make sure all the stars are aligned,
Mhm.
doctor's appointments and all of this stuff. And how do you care for you? And do the people understand um, what it means to actually care for yourself? It was a big role for me to realize that self-care was important. That putting that mask on you in the airplane, save yourself so that you can save others, was like huge for me. Being able to turn my cell phone off for 2 hours a week, and it's so funny. I tell my kids, I had four of you, so only one of you can have a problem and the other three can deal with it. um, but letting other people carry your bucket of water, let other people carry the burden for just 2 hours. And I am a very faith-based person. And so, whereas I am very aware of what responsibilities I play in different positions and what my role is, I also realize that I'm a human being, and that being in this constant fight or flight, and I don't know what flight is, so I'm always in the fight, creates these issues. And what is the stigma between mental health and African Americans um, seeking assistance? I grew up that with just culturally and in our family, you don't need to go tell anybody your problems. Your problems are in this house, and that's where the solution will be, in this house. We didn't go seek help. We didn't get anyone. And from a religious standpoint, it was always, well, have you prayed about it? If you pray about it, you'll find the answer. You don't need to go talk to anybody, especially somebody that's not of the faith. You don't want to go and talk to them about anything. So you have these two cultural issues, that go right along together to drive you right off the edge of a cliff. And so how do we get around those, and how does that conversation happen? And I think the first thing is non-judgment, and sometimes those judgments come in blank facial affect. I come to your office and I sit down and I tell you I've got XYZ going on, and the person sitting in front of you goes, and it's, well, I'm glad you're here, that you trust me enough to help you through this journey, because it's so significant that that it is trust, that to walk in your door, to sit in your office. And by the way, the longer you make me wait, the longer I think I'm not supposed to be there.
Right.
Because you already feel guilty for having to come to somebody's office. And so you're thinking, okay, I've only got an hour and now I've wasted 20 minutes in your lobby. And then when I get in here, I'm going to have to rush through everything. And so you're always in this heightened state of, I've got something else to do. And so just, sometimes a deep breath and, accepting and verbally announcing that you will accept the trust that we have given to you is a huge thing.
What has that process been like for you as far as prioritizing self-care and realizing that that was something to put in a more prominent role in your life? Was that a particular event or something that just sort of happens over time?
No, it was definitely an event. I am definitely reactive in these days and not proactive. I actually had a horrible day. I got the diagnosis from my mom, that she was ill. My younger daughter had a car accident. My older daughter was diagnosed. Dakari had a seizure and was headed to the ICU for the next issue. My 33-year-old was having a major meltdown in the middle of the front yard with the police and, the fire department that were there to see about my son. And so this extreme heightened, he's a Black young man. Will he be shot? Do they understand that he has a special need? What the hell is going on in my life right now? And I thought, if I could just get everybody settled long enough to sit in the car with the car in the garage with the car running, I could make this all go away. It was I was very aware that I needed for something to stop or everything to stop right there in that moment. And I thought, okay, I could just, sit in my car and just, that way I could just go to sleep. I could listen to some music. It'll be the first calm moment I've had in 2 years. I could do this. And then I began to think, but someone's going to come in the house and see the laundry not done and judge me. And someone's going to see Theodore having a meltdown and judge me. And my God, I just don't have time to die. I'm just going to have to pull it together and find someone to help me. And I know those are very odd reasons not to kill yourself. Thank God I hadn't done laundry, but it was in that moment that I knew I could not handle everything. There was not an S on my chest anywhere. And I knew that in an effort for me to be the very best for my kids, which is my goal, I needed to do something for me. I'd had a horrible divorce, just a couple of months before, and I already felt like I wasn't enough. I had spent 8 years feeling like I wasn't enough. I was the executive director of several nonprofits. I was Muslim of the Year. I was Mom of the Year. I was advocate. I'm a chaplain for the Oklahoma Department of Corrections prisons for the Muslims, all of these things. And yet I felt like I wasn't enough and I felt like I needed help. And just so thankfully, I ran into somebody that was in the mental health department. And, they sat down with me and we were able to just have a conversation that it was okay to be broken. And I felt like I really was. And so I think that moment of just wanting everything to be silent was the turning point for me.
That's really powerful. Thank you for sharing that. I think that these are really helpful conversations to have on an individual level, and I'm wondering more about, from an advocacy perspective, in terms of outreach from mental health, how can we meet families where they're at, make services more accessible, from your perspective and your experiences, talking to other families? Are there certain things that kind of come to mind when trying to break down some of the stigma and those types of things?
Well, I think that everybody has looked at the COVID era and telemedicine as such this horrible thing. They can't go here, they can't go there, but welcome to my world. I had to keep my kids in a bubble long before COVID. And, but I think that this is a good thing. I think that this has lended itself to making accessible services to parents like me, to caregivers, and having a 24-hour mental health appointment. Your day may stop at 5, but mine doesn't. And so even a 4-hour block of appointments on a Saturday, where I could send the kids in the backyard to play, or I can go sit in the closet, or I can do wherever. And, avoid comments for parents like, are you sitting in your closet? Yes, I am. I might be in the bathroom next week, because you're looking for that place that you can sit and talk, without the kids listening, without the hustle and bustle of the world. I need just a few minutes to focus on me. And how do we do that? How do we find that? But most definitely offering services to, not just moms, but sometimes we need to feel special. Sometimes we need to know this is for caregivers. Sometimes we need to know that it's for caregivers, and we have created this venue for you. Everybody wants to feel special, everyone. And sometimes that is the only moment you have. And so in that moment, and how can we create these conversations? How do we make these things available? So, Facebook groups, and everybody is social media, Instagram groups, where you maybe have a workshop of it's okay to be broken. Even broken crayons color. So, it's okay. It's okay to have a bad day. It's okay to cry. Tears don't make you weak, tears make you wet, you know? And so these things that sound like cliches, but they're so important. And sometimes cliches are the end of the rope that you're holding on to. That is all you have left in the tank. And so being aware that you are maybe the only reason that someone hasn't sat in the garage. Maybe you are the only reason that someone has found hope, but making that hope accessible. So are you online? Are you, telemed? Are you a weekend provider? Are you an after hours provider? And walking a mile in someone's shoes, and I know that's difficult I would never expect anyone to understand the many layers of my life, but let them explain it to you in terms that are dear to them, whether it's profanity, whether it's whatever it is, let them color their picture with the color they choose.
Absolutely. Has there been a difference in terms of the type of support from kind of early diagnosis stage or depending on age, different types of caregiver role? I don't know, has your perspective on that shifted looking back?
I think looking back, my roles for mental health or stuff. So to add another layer, I'm a widow. My husband passed away of the same disease that my daughter is facing. And, when my husband passed away and I was a single parent of 3 children, and I was diagnosed with cardiomyopathy and systemic lupus and told that I didn't have very long to live either. And there was no mental health for me. No one saw fit in all of this stuff to say, maybe she's not okay. Maybe she won't. And I remember the only person that spoke up was my uncle. And he said, don't worry about it, little girl. Heaven doesn't want you and hell's afraid you'll take over. You're going to be okay. That was like the only mental health I got for, several years. And so I am seeing a little more now with Dakari, that's 12, as we go through, the ICU stays and such, doctor's appointments. I have seen more of a presence of mental health providers, of the words mental health. How is your mental health in just doctor's appointments? Are you all right? Is your caregiver all right? And those are great questions. And I think that we do need an interdisciplinary team to make some of these things happen. It's important. It is extremely important that mental health connect with physical health. So are you connected with a doctor that will allow you to be present, in the care, not maybe in that moment, but in that care? And so how do you connect? Most people don't go to mental health doctors unless, they're either forced to or they're at their wits' end. But how do we get to you before you've reached the end of your rope? How do we help tie a knot in that rope and hold on? And so maybe that is more of situational, referrals, and being more out there, I think is great, because it feels good now to know that you guys are here, that you're present, and you're willing to help and you're available. But how do we let other moms know and other dads know that you are available? Oklahoma is in the top 2 for female and male incarcerations. And so that means someone is caring for those kids. That means someone is caring for whoever is left behind. And how does the mental health facility play into that? We are seeing more and more shootings and violence and, Black Lives Matter, Asian Lives Matter, all lives matter. I think that mental health and psychology should be at the front of that line. How can you help? We're running a race, And you guys are indeed the watering stations that we need.
Mm. Kind of building in these touch points to these systems that already exist, whether it is the doctor's appointments or other sort of physical and non-physical spaces, it sounds like.
Yeah. And you know, it is important. And do other physicians know where you are and how to reach you? And okay, your child has been diagnosed with this traumatic disease or injury, or even if you don't see this as life altering, it will be. And how do we help you connect to someone to help you down this path? Because clearly, if I'm not okay, Dakari, my son, is not okay. My mom is not okay. My family's not okay. The people that depend on me are not okay. And so how do we make me okay? You know, and not so much a focus on mental health as mental help.
So even shifting the language that we use.
You know, words are important. Words are powerful. And so when someone tells me, have you thought about seeing a psychologist? I'm not crazy. You know, those are some of the first things that you hear. Or as a mom, are you going to tell me that I'm not enough for my kid? Are you going to judge me? Or am I going to say something to you that will lead you to call DHS on me? You know, if I tell you that I fell asleep yesterday with my kid in the toy box playing toys, and I took a 2-hour nap while he was happy and healthy and safe and, you know, everything, are you going to call DHS because I took a 2-hour nap? You know, if I had a bubble bath and a glass of wine after I put the kids to bed, disclaimer, I don't drink, but if I had a, you know, a glass of wine and a bubble bath, are you going to call DHS on me? If I send my child to his room with an egg timer, and so I set one time an egg timer for 15 minutes. And I told my children, I have been very bad today. And I'm going to time out for 15 minutes. You guys watch a movie and mommy will, you come and get me when my timeout is over. And so I sat in my room, just listened to nothing, you know. But, you know, my worry was, okay, I need to listen for them, because if something breaks, if they do something, could someone tell me that I wasn't a good parent? And so, you know, letting people know that my kids were safe, they were fed, you know, they were not in harm's way for 15 minutes, you know, but that was okay. And so a lot of parents don't have the language or the building blocks. Some of them are a product of their past, product of their parents' generation, and they don't understand, okay, if you build these safeguards, I'm going to put you in your room with the book for 10 minutes. Mommy needs to breathe and you are okay. You know, that's not child abuse. You know, and that it's okay for people of color and people of faith and people to seek this kind of help. And words are important. So mental health may not be my cup of tea because I'm worried, but mental health, mental support, you know, mental advocacy, those are words that are inviting to the.
Yeah, that's really helpful. Thank you. Have you seen differences between more pediatric or child focused facilities and adult focused in terms of the caregiver support that's available?
Absolutely. Absolutely. So assistance for my little, my 12-year-old, that assistance is right there. You know, we are currently at the Children's Center, having spent 2 or 3 weeks at ICU. I have actually in 2021 spent more time in ICU this year than I have at home. And so having mental health people and these mental health checks and, okay, Dakari, how are you doing? And even at Children's Hospital here at OU, having sitters, you know, look, did you know that we could get you a sitter so someone could come and sit with him for 2 hours or an hour for you to go and take a bath or wash your hair or walk the parking garage, whatever it is that you need to do. And so I do see it more pediatric driven, whereas my daughter, who is older, there has been no mental health for her. There has been no help for her. And she has gotten some support psychologically, just because her mom made her. You know, having been told you're a brand new mother and she's had a stroke and, you know, she needs a new heart, all at the age of 27. And, you know, a separate conversation of, you know, she's African American. And when she was told she had a pain or she had this or she had that, it was ignored until she had a stroke, you know. And so it was me that told her, okay, you need to have someone to check in with. You know, we need to have, and it doesn't need to be me. I need to be here to wipe your tears, but someone else needs to see about your mental health, someone very outside this picture. And so it was hard for us to find someone. She actually had 3 or 4 appointments and she just didn't vibe with them. And that's okay. Mm-hmm. Not everybody is right for every situation. And that's okay. You know, but I did find it harder for my adult child to get assistance. It was not freely offered. Whereas for the pediatric, for my younger child, it is offered.
Mm-hmm. Yeah, sounds like there's a gap kind of between that young adult age where that support kind of drops off for families.
Yes, it really does. I don't believe she was ever offered, you know, that extra assistance.
Mm-hmm. Are there any other kind of tips or tricks or anything that you would want mental health professionals or trainees to kind of to know about when working with families?
First of all, thank you for what you do. You know, this is a difficult road as I see it. You know, being able to sit and listen to someone's problems and to form a plan for them and kind of give that back, you know, because no matter what you do, something's going to stick. You know, if you throw a rock into water, even when that tumultuous water calms, that rock is still there. And so being the gatekeepers of our mental stability is a huge responsibility, and we're grateful for you all. But I'd also like to say, have a humble heart. You know, and I know this is going to sound hard, but I know everyone is proud of their doctoral degrees and such. You know, we want you to have those. We want you to be professionals, but your pictures of your boats and your pictures of your dogs and your ski trips to Vail and stuff like that, maybe have it in a book on your desk, you know. But I remember walking into an office one time and looking at the wall while she was doing something else and thinking, there is not a dadgum thing this woman is going to identify with my life or nothing she can tell me. I've been poor all my life. I've been broke all my life. My life is a complete struggle. What possibly could she tell me or do? You know, I see ski trips, I see this, I see that. And I know that's judgmental, but that is where I was. Mm-hmm. And having spoken to other families that we advocate for, that's the first thing they say is, you know, they have all this grand and glitz. I remember someone telling me, this heifer had frames from Target. I still shop at the Dollar Tree. You know, and I'm thinking, Target, wow, you know, but that was where she was. And that moment was difficult for her. Mm-hmm. That was very hard. She felt like she was putting herself in a space of someone that was never going to know her struggle. Mm-hmm. That was never going to be able to identify on any level. And so looking for identifiers, I know as a professional, you don't tell your life, but you know, I'm a woman and I do understand women's struggle. I'm a man and I do understand a man's struggle. I'm a parent or I'm a sister or what is the identifying role that's going to allow me to put, oh, you drink coffee? I love coffee. I have glasses too. Oh my God, you know, something that will allow me to feel like there's something about my struggle that you get, you know, somebody that you're on the same path with me. You know, I want to feel like I'm not pouring into your bowl of pity, that you're going to pity me. And so I think that would be the biggest thing for me. Understanding family-centered language, understanding person-first language, understanding culture, you know, and don't seek to be culturally proficient because you can't.
Yeah.
You cannot be culturally competent or efficient or proficient. But what you can be is culturally understanding, culturally accepting. And accepting something doesn't mean that you agree with me. It just means that you're okay with what I'm okay with.
A beautiful summary. Thank you. Thank you so much for your time today. We really appreciated you sharing your story and your perspectives. I think this will really help a lot of our colleagues and trainees in the work that they're doing.
Well, thank you so much for having me, and good luck on your journey.
Thank you. If families or professionals are looking for additional resources for how to provide care and support for families using plain language in their work and other resources, please see our website at the Center for Pediatric Psychology at Oklahoma State University. Thank you.